Hello, my name is Laquana Williams, and I'm an Associate Program Director with Prevention Institute. Today, I'm going to be sharing a little bit with you all about our Advancing Racial Justice for Health project. It's a project in collaboration with Big Cities Health Coalition and Prevention Institute. So this project is a joint project of BCHC and PI, and the planning phase was funded by the Robert Wood Johnson Foundation. This project worked to analyze declarations and the evidence of activities and equity infrastructure in 16 BCHC jurisdictions, and we did that using publicly available online sources. In addition to this, we also conducted interviews with 18 public health leaders across 8 BCHC jurisdictions so that we could better understand the successes and challenges associated with taking action to dismantle structural racism and to advance racial justice. And finally, we conducted interviews with community-based organizations and networks to get their perspective on what was happening in communities prior to the passage of the declarations and to better understand what has been taking place since then. These lists include information about jurisdictions where we focused our efforts. So on the far left is where the analysis of the declarations took place. In the middle is where we interviewed public health leadership and also conducted some analysis. And on the far right are the community interviews that we conducted. And that will be the focus of today's conversation, what we heard from the community interviews. So here were our methods. 10 jurisdictions were invited to participate in our community interviews. Those interviews looked at jurisdictions who had a mixture of resolutions, statements, executive orders, proclamations, and declarations. We did that because we wanted to make sure that there was diversity in who we were hearing from and what we were learning based on the type of statements that were passed. We also looked at a combination of jurisdictions that overlapped with the research that was conducted by Drexel and one of our independent researchers. We identified jurisdictions where operationalizing racial justice could potentially benefit people of color the most. So we wanted to better understand where folks of color would be benefiting from the work happening in these areas. And finally, we looked to understand what was taking place in the communities prior to the passage of the declarations. So the community interviews we conducted took place in Riverside, California, Milwaukee, Wisconsin, Long Beach, California, Southern Nevada, Chicago, Illinois, Los Angeles, California, and Springfield and Dayton, Ohio. There was a lot of overlap in the community interviews we conducted based on what we heard geographically. And essentially, the bulk of what we realized jurisdictions were wrestling with was how to really make meaning and sense of the passage of the declarations. So working to identify what the declarations mean to both community as well as decision makers. And outside of that, there were 3 major buckets where we found that folks had the most to say about the declarations and resolutions. This was in the area of partnerships, funding, and narrative. When it comes to partnerships, what we understand based on the community interviews is that while new and old partnerships around racial justice work does exist in communities, there's still so much room for opportunity to improve. Around funding, what we heard from community is that funding feels quite scarce and that it is still not going directly to community. So there are challenges in how we are distributing resources in a racially just way. And finally, around narrative, better understanding what outcomes actually counts as wins and who gets to decide what the wins are. So there's a focus on really naming and disrupting anti-Blackness in the work around the declarations. So we're going to go through each of these three categories and share out some common themes as well as some quotes that we heard from community. The first segment is around partnerships. One community interview participant stated, "I hope the declarations encourage the field of public health and those who are excited about true partnership opportunities to work differently." So as you can see here, there's some optimism around what it means to work in partnership with community, but there also appears to be a little bit of hesitancy with the word hope. Another community participant stated, "I would like to see a more direct line between the community and the people making these declarations. Instead, they seem to go to the usual national organizations." And this is pretty significant because one of the things that came up consistently in the interview process was that there tends to be some gatekeeping around who's included as a partner and who's invited to the table and what their role is once they actually get there. And so community participants have noted that the same people that are usually tasked to participate in these processes are also being tasked to weigh in on operationalizing racial justice through these declarations and statements. However, they're looking for more diversity within the voices and who gets to be included. And so I think this particular quote really represents that well. Another participant stated, "There are a lot of historical barriers that we must break down while still holding the door open for other Black-led organizations that are coming behind us. Sometimes it is very exhausting being the first because we don't have the benefit of being average in terms of quality grant writing or reporting. We must be excellent." So this is a partnership quote that came from a participant who was really struggling with keeping up with some of the red tape that comes along with being in partnership with large agencies and really feeling like they didn't necessarily have the bandwidth at all times to really keep up with some of the reporting requirements. And so in order to be a better partner to a community-based organization like this one, they're looking for innovative strategies to really help to support those true collaborative partnerships. The next category that we heard most frequently from community interview participants was around the topic of funding. One participant stated, "Just give the community the money and trust that they will do with it what needs to be done. We must clear the red tape." So this particular person was talking about how important it is to get the funds directly to community and to really cut out the middleman so that there isn't as much work and as many hoops to jump through in order to do the work. Another stated, "Governmental hiring practices need to change. Demographics are not diverse. The people who lead and sign checks are generally white." And so this person is saying that they believe that improved efforts around diversity in governmental agencies would actually help to support the work that's being led by Black and Brown communities in each of these jurisdictions. And so that there needs to be a twofold approach to the work, in that there are also people who are working inside the system who understand the dynamics that are taking place in community and can work to improve opportunities for everyone. Finally, there's narrative change. One participant stated, "I think everybody is waiting on the proverbial pin or shoe to drop, when people will say, well, we've already committed money to these racial justice efforts, but now we're done with that." So this is a quote where you can see that there's definitely some fear around scarcity associated with funding racial justice work. Another stated, although well-intentioned, I think the declarations added a period at the end of the sentence that allowed government agencies to feel like they've done their part, even though their practices are literally harmful towards Black and Brown people. So this quote, the intention behind this quote is to share that there's still additional work to be done outside of creating and passing a declaration or a resolution. Another stated, the declarations are large-scale acknowledgements that are supposed to be helpful, but they don't go far enough. Sincere acknowledgement and sincere action is what it takes to move the needle. So again, participants are noting that there's so much work to be done outside of simply passing resolutions and statements, but rather there's additional work, continuous work that happens over time that helps to continue to build relationships. Given this, there are so many more efforts for future exploration. Here are some of the ones that we've noted through this project. We'd like to better understand how organizational and administrative change translates into progress for the community. We'd also like to know what does an increase in partnering actually mean? What does it look like to partner better, to create new and more sustainable partnerships, and to leverage the existing ones? We'd also appreciate exploring how local health departments are doing more to center people of color, how they are working to directly fund racial justice organizations to do the work, and what's being done around engagement and what engagement looks like when it is done well. Understanding how local health departments have been partnering differently, in particular with people of color, is another area for future exploration. And finally, understanding in what ways does community hold narrative power, and how might we actually measure progress towards success, and what counts as wins. Thank you for taking the time to participate in listening to what we learned from community. We appreciate your time and effort.